Hi everyone, it's Narelle Cook from CanineCeuticals and welcome to another week of Thursday's Thoughts. This is where I share bite-sized pieces of scientific information that I find really interesting and I hope you do too. So today we're back on one of my favorite ingredients, and that is palmitoylethanolamide. So a few weeks ago we looked at P.E.A, which is it's abbreviated to for reducing allergy symptoms in dogs with atopic dermatitis. But today I want to look at its other main use, and that's for managing chronic pain in cats and dogs. So this is a review paper from, I think it's 2021, yes. So really current. It's 31 pages long, so we're absolutely going to fly through the paper and just look at the key points. But this whole paper was assessing, is there a place for P.E.A for managing chronic pain in dogs and cats? The answer is yes. And if you're motivated, you can read all 31 pages to discover that for yourself. But what I want to really highlight is just the breadth of different pain conditions that P.E.A can be helpful for in our pets. So if we scroll down, look, this is highlighting the main causes of pain in dogs and cats. You've got, chronic lesions, skin ulcers, there's chronic inflammatory diseases, we've got disc herniation, chronic injuries, pancreatitis, IBD, cystitis, then we've got diabetic neuropathy, discompression syndromes, and cancer. But what's really fascinating, among all of the possible causes of pain in our pets, one of the most frequent ones is actually osteoarthritis. And when they reviewed data in the UK, they found, and this is mind-blowing, that 20% of dogs older than 1 year and 80% of dogs over 8 years have some degree of osteoarthritis. And for cats with a mean age of almost 10 years, 92% of those cats had some degree of osteoarthritis. So seriously, if you have a dog or a cat that's getting on in years, chances are they do have arthritis, and they may be in some degree of pain that you may not be aware of, because our pets, some of them are very stoic. I know one of my French bulldogs is, and they may not be showing that overtly to you. And there's lots of drugs that are used to treat chronic pain, your non-steroidal anti-inflammatories, opioids. There's things like, gabapentin, SSRIs, SNRIs, the tricyclic antidepressants can be used. The problem is whether they're used together in combination or separately, a lot of them still fail to provide complete pain relief. And even worse, they come with a lot of side effects when they're used long term, which is not what we want. These are just all animal sort of laboratory studies where they inflicted some form of pain on the animal, which is horrible, gave them P.E.A and saw significant reductions in pain. So we'll skim through that. But here are some other animal studies and the types of pain that they were experiencing. So things like, sciatic nerve injury and spinal cord injury. So absolutely, for my French bulldog that suffered a severe spinal cord injury and had paralysis of her hind legs, P.E.A was a fundamental part of her treatment protocol. Chronic constriction injury, diabetic neuropathic pain, osteoarthritic pain. And then the good thing about this paper is that they also summarize the human clinical data. And this really gives you the range of conditions that P.E.A can be used for. Again, you've got sciatic pain, diabetic neuropathy, lower back pain. I mean, how many of us experience lower back pain? Carpal tunnel syndrome, chemotherapy-induced pain. There's pain due to failed back surgery, lots of lower back pain, burning mouth syndrome, that's a bit random, fibromyalgia, just going through, headaches and migraines. So if you experience those, P.E.A might be helpful. And again, all the sort of osteoarthritic types of pain. But this is really interesting too with, chronic pelvic pain associated with endometriosis, dysmenorrhea, or interstitial cystitis. So that's something that a lot of people wouldn't even think about with the use of P.E.A, and irritable bowel syndrome, and again, bladder pain, So really broad range of use. All right, this is really significant. So what I want you to understand, there's something in science called the number needed to treat. So basically that's the number of patients you need to treat in order to get one patient that has at least 50% pain relief. So with the number needed to treat, it's basically a measure of the effectiveness of an intervention, whether that's a drug or a supplement. So the lower the number needed to treat, the more effective is the intervention. So they actually compared micronized P.E.A. with some standard like first-line treatments for neuropathic pain. So with the P.E.A., the number needed to treat was 1.7. So they only needed to treat 1.7 people to get at least a 50% pain relief in one patient. And you compare that to, let's say, gabapentin or pregabalin. So 6.3 and 7.7 people needed to treat to get at least one patient with at least 50% pain relief. So that is huge. Like, if that doesn't blow your mind, I don't know what does. Looking back at the animal studies, they had horses that were lame and could no longer do show jumping. So these horses were given P.E.A. for 4 months. And at the end of the trial period, well, it says 3 months later, lameness was graded 0, allowing successful return to show jumping without disease recurrence. So I've said previously, I'm not a horse person. If you are, you might consider P.E.A. And they also highlighted here a dog study with medium to large breed dogs with chronic osteoarthritis and persistent lameness that had gone on longer than 1 month. So all dogs were given a P.E.A. blend for 4 weeks, added to their food. And as similar to the horse study, the lameness was found to significantly improve across the treatment period. So bottom line, as you can see here, as reviewed here, there is now strong evidence supporting the dietary supplementation with micronized P.E.A. either as an alternative or an add-on to conventional treatment in the management of chronic pain. So I mentioned when I was talking about P.E.A. for its use in atopic dermatitis, it's extremely safe, it's extremely well tolerated. We don't expect to see any adverse side effects from P.E.A. And the amazing thing is it can be safely combined with any prescription medications that your vet might be prescribing. So whether that's for allergies or chronic pain, like, you know, your non-steroidals and your gabapentins and the like, P.E.A. can be safely used alongside those. So if you've used P.E.A. for a chronic joint condition or pain condition in your dog, you know, let me know in the comments. I'd love to hear people's stories about how they've used P.E.A. and the results that they've obtained. If you have any questions about P.E.A. or the use of P.E.A. for your dog or cat, please email us at info@CanineCeuticals.com.au. We would love to help you out there. Jump onto our website, CanineCeuticals.com.au. We've got amazing resources under the resources tab, guides, blogs, podcasts. So really great information that you can access freely. Please like us on social media, canine.ceuticals. And if you've got an ingredient or a product that you'd like me to review, please comment on that as well. So thank you for another week, and I'll see you next week.